Hey there, welcome back to another Eye Care for Your Brain with board-certified neuropsychologist Dr. Karen Sullivan. Today I am going to start a series called the Top 10 Secrets to Brain Health. We are talking about the science-based proactive things that you can do in your everyday life today to guarantee a more dementia-resistant brain in the future. The secret of brain health really comes down to balancing two things. One is lowering the known risk factors for less than optimal brain health and increasing what we call your cognitive reserve. So when it comes to risk factors for dementia, we really have two types: non-modifiable and modifiable. Within non-modifiable, which means things you can't really do anything about, there's really only two. The first one is age. Age is the number one risk factor for cognitive impairment, including dementia. The older we get, the more likely we are to get the various subtypes of dementia, but it's not inevitable. And in fact, we have a lot more control than you might think. You just have to know the right things to do. The second non-modifiable risk factor are your genetics, your DNA from the moment you were conceived. We either have genetic mutations or genetic variants when it comes to predicting our risk for dementia. Mutations are rare. They're faulty genes that mean no matter what you did in your life, you were unfortunately going to get that subtype of dementia. One good rule of thumb is the younger someone is when they get dementia, the more genetic it is. The older we get and those genes start to express themselves, the more likely it is to be related to a variant. These are much more common, and this means that there's something in the environment, a risk factor, that turns on the genes. You can kind of think of it like a lock and key fit. The modifiable risk factors, these are 15 things that are most likely to cause those genetic variants to turn on. These are hypertension, type 2 diabetes, cholesterol, sleep apnea. Now, what I want you to know about those four is it's really related to being untreated. When they are optimized, the risk goes down quite a bit. Then we have repeat head injuries. So what we're talking about here is more people who were involved with contact sports or military folks who unfortunately are exposed to potentially a lot of blast injuries or multiple mechanical falls. Then we have untreated hearing vision loss, polypharmacy, which is related to taking too many medications over time. These also include over-the-counters and supplements. Then we have delirium, we have too much alcohol, smoking, not enough exercise, poor diet, social isolation, depression, and low mental stimulation. Now, I know that was a lot of information, and I just came at you with all sorts of things that are probably reverberating in your mind and you want to remember, but we're going to go over those in a lot more detail later. So that is the reducing the risk factor side. Then on this side, this is the more proactive side, you want to increase your cognitive reserve. So cognitive reserve is related to this phenomenon of putting deposits into your brain bank every day by doing things that cause you to have to put in strain and mental effort and develop expertise, things that you do over and over again, like acquiring knowledge, education, cognitively complex hobbies. About 25% of people who have Alzheimer's disease at the level of the brain, such that you would see at autopsy, don't actually ever express clinically significant memory loss in everyday life. And this is where the idea of cognitive reserve came from Dr. Yakov Stern at NYU. And he told us that there is 1 in 4 chance that you could have Alzheimer's up here, but actually never manifest it clinically in real life. And he said the buffer on that was cognitive reserve. So these are the intellectually stimulating things that we can choose to do through our jobs, through our free time, our interests, that will allow us to create not only ways of compensating for cognitive loss, but also a physiological resistance to the disease and damage caused by the different subtypes of dementia, including Alzheimer's. So that's pretty amazing. So the more cognitive reserve we have, the more brain disease is needed to result in impairment. That's pretty significant. So tonight we're going to start this series where I'm going to go through my top 10 brain health secrets one by one. So tonight we're starting with number 1. The first thing that I want you to understand about true brain health, so this is what is written in peer-reviewed journals. This is not related to buying a product. These are behaviors that are driven by you, and this is the true path to brain health. You're not going to get it in a supplement. It's not going to come from doing one game on your iPad at home. It's going to be the cumulative impact of these 10 things that I'm going to share with you over the next few weeks. So tonight we're going to go through number one. Number one is to optimize your senses. This is eye and ear health. All the information that your brain is acting on comes through the bridge of our senses. We know that both hearing loss and vision loss are incredibly common as we get older. Hearing loss is present in about 65% of people over the age of 60. That's pretty significant. So that's age-related, just the small, teeny, remember learning that those teeny tiny bones, the smallest bones in the body are in your ear? Well, over time, they can start to get a little bit of wear and tear, just like any other bone system in the body. And so you just start to get an age-related decline. But we also have to think about noise exposure during the lifetime. That can come through things like construction, can come from things like headphones, it can come from military exposure. But we also have substances in our environment that are also toxic to those teeny tiny delicate physiological auditory systems that exist in the ear. So we've got multiple things that over time can actually build up to give us hearing loss. And we've known this for maybe about 20 years now, that untreated hearing loss is a very strong independent risk factor for developing dementia. So what I mean by that is even in people who smoke, aren't active enough, don't eat the right things, if they have untreated hearing loss, that trumps everything else. And we theorized for years, well, why is this? And people thought at first it was mediated by depression. So when you don't hear well, you're not going to want to go out because it actually is quite frustrating, especially in a small group setting. Discriminating between human voices turns out to be one of the most challenging. It really gets in right on that Achilles heel of the hearing loss. So people tend to turn down social invitations and they don't go. And we used to think that was the moderating factor, but what we actually know now is that it's due to brain cell loss in the auditory cortex. So cells in the auditory cortex of the brain, which are kind of right here on either side, they are tuned to very specific frequencies. That's what makes them fire. And when they don't get any stimulation, they basically self-destruct and go on. Once the brain kind of learns that process of what we call apoptosis, which is self-destruction of a neuron, the concern is that the brain kind of learns how to do this. It now has a program, and the next door neighbor to the auditory cortex is our temporal lobes, medial temporal lobes, which control memory. And so what we think is they almost call it like the marching of death in the brain, and that's not something that we want to start. We want your brain going in the direction of vitality and plasticity and health. So what we didn't know up until very recently, and I mean within the last few months, is if we treated hearing loss with consistent use of hearing aids, would that do anything to the risk for dementia? Now that would make logical sense, right? But we just didn't have the data. So sure enough, Lynn et al. In the last few months put out a paper saying that people who had hearing loss, who we already identified would be at high risk, were able to cut their risk of dementia by 48% by using hearing aids consistently over 3 years. That's incredible to get that level of power from an intervention. So the key there is they had to have had a hearing test. So you should have one once every 2 years if you're over the age of 65. And then the key, and I find this in so many of my patients, is the using them. You have to actually make a habit, put stickies on the door, don't leave the house without them. You have to actually get your brain used to getting that stimulation day in, day out, every waking hour, not just when you go out, not just when you go to the doctor's office, not just when you're Spouse nags you to put them in, but all the time. We know a lot less about how low vision acts as a risk factor for dementia, but what we do know is it does increase the risk specifically of Alzheimer's disease and vascular dementia. And the lower the vision, the higher the risk of dementia. We have not gotten to the point yet where we look at how we can reduce risk by correcting vision, wearing the correct prescription, making sure glasses are clean, all of this common sense stuff. But surely that data is on its way down the road. So that is my number one tip. And if you'd like to continue this journey with me, keep watching. I'll see you next time. Bye.